Good afternoon. Mike Jones, Fire Chief, City of Fredericksburg. Let's talk about the statistics and a few other informational items about COVID-19 and the crisis that we're facing. We didn't have a great day yesterday as far as the health district goes. We had an increase of 36 cases in the health district. We're now up to 475 total. 240 of those in Stafford, 143 in Spotsylvania. King George had 32, Caroline 27. We had 5 new cases overnight. We're now at a total of 33 cases in the city of Fredericksburg. But part of that can be attributed to the increase in amount of testing. When you start looking at what we've been testing over the past several days and weeks in Virginia, we've been down below or right around 2,500 tests. Between yesterday and the day before, the total tests increased to over 5,000. So when you're going to have more testing, you're probably going to also have more positive results that come back from that. The good thing is the results in the health district, the number of people that are tested versus the number of people that are positive, still staying flat at 13%. So that's a good trend as far as that goes. In the state or Commonwealth, it's still up around 17%. We have one more death that we have to report that occurred in Caroline County for the health district, and more information will be coming out about that, but we're now at a total of 10 deaths in the health district. And unfortunately, we can no longer claim we don't have an outbreak, as we have recently had an outbreak reported in Spotsylvania County where a total of 7 people have tested positive that were working in a group together. They're now tested positive for COVID-19. So we don't have that. But in the hospital setting, we are at 22 people that are positive tested for COVID-19. The hospital still has plenty of capacity and plenty of ventilators, so we're in good shape there. The rest of the statistics for the Commonwealth and the United States will be posted on our written page. Let's talk a little bit about if you have someone in your home that you're either providing care for or have a loved one you're providing care for that has suspected COVID-19 or is a positive test of COVID-19. How are you going to take care of those individuals? What can you do? Here's some tips that come from the CDC about being a caregiver for someone that has COVID-19. First and foremost, provide support and help with basic needs. Make sure they follow the doctor's instructions for medicine and rest. Provide plenty of fluids, assisting them with medications, and make sure that they have meals and that the grocery shopping is done and that their pets get taken care of. You probably want to separate them from their pets as well, just for the period of time that they are going to be contagious. Watch for any warning signs. If they're at home convalescing, we want to make sure that they don't get worse. So if the cough gets worse, if the fever increases, if they have difficulty breathing, then you either have to get a hold of the doctor's office, or if the conditions get severe enough, you're going to need to call 911 so that those individuals can be transported to the local hospital. Limit contact. Have the sick person use their own personal bathroom and bedroom. Try not to share bedrooms or bathrooms if at all possible. Avoid visitors coming by and talking to them. I know they're going to not want to be isolated and they're going to want to talk and deal with people, but at the same point in time, we try to isolate them a little bit and keep them away. If they must use shared facilities like a living room or a den or something like that, make sure that you have good airflow through there. If you have to, open the windows, put a fan on, something like that to take care of those situations. Have them eat in separate rooms or areas, and the same thing as the caregiver. Make sure they're there in a separate room. So the sick person should eat in their room, and you other people in another room or area. Wash the utensils and dishes from the sick person with hot water and use gloves. Make sure when you wash your hands after you take the gloves off, and practice good personal hygiene. Avoid sharing any personal items with those who are sick, including dishes, cups, silverware, towels, bedding, or even those electronic devices like cell phones. Sick persons should wear face coverings whenever they are around other people at home, or if they have to go out to like a doctor's office visit or someplace else. Caregivers should wear gloves anytime that they may come in contact with a sick person, especially if they're dealing with the person's bodily fluids. Dispose of the gloves immediately afterwards and wash your hands. Caregivers should wear face coverings anytime they are caring for the sick person. And also, after leaving the area of the sick person, practice good personal hygiene. That's washing your hands with soap and water for 20 seconds. That's making sure that you don't touch your face or your eyes or your nose or anything like that. If you have any additional questions, and we can try to answer them, we will. You can always get a hold of the city at 540-372-1010, or available at www.fredericksburgva.gov. Thank you.